Joining us now is Dr. Lisa Zimmermann. Welcome to the show. How are you?
I'm doing great.
Good.
Happy to be here.
Yeah, I'm happy to have you here. I used to work at Barnes Hospital, which was a large facility in St. Louis, Missouri, and worked with a lot of their clinical service lines. I've been someone that's always been fascinated about medicine. What made you decide to do this as your journey?
Oh, well, that's a complex question. I always wanted to be a doctor,
Okay.
and I started out very traditional, but then along the way, my youngest daughter became chronically ill, and no one could figure out how to help her. So then that led me into functional medicine, which is really looking at the root cause of what happened to the patient's health in a different way, and that's led me down this whole journey.
You had a very strong why then.
Right.
Really strong why. And that's basically what we were talking about before, is that that's what you do. You find when someone is chronically ill, you are almost like an investigator, right?
Right. I wasn't going to give up.
Yeah. So tell us about that. So when a patient comes to you with many different symptoms, right? What is the process like? They
Right.
find you, hopefully, right?
Right. So many of my patients have been down many specialists, have seen at least 10 doctors. Then they find out about how I'm going to investigate what's really truly the root cause and see if I can achieve health for them again. So part of the process is they'll come in and I listen. I take a very long history. Part of what I do is I think the hint is in the history and no one's listened to them before.
Okay.
So you have to look at what happened, when were they healthy, and when did they start having symptoms. And then based on that history, it might point me in the right direction of what tests to use, but a lot of the conventional blood tests are not the ones that I need.
Okay.
They're the more forward blood tests that are developed by labs that are, I would say, on the cutting edge.
And that's who
And
you're working with.
That's who I'm working with to investigate what happened to their health.
Is Lyme disease considered a chronic illness?
Yes.
That you kind of have to, so the symptoms may take a long time to develop, and then you're kind of walking them through
Well, usually
something? Or,
in a case of tick-borne illness, the patient really hasn't had the proper testing to determine that that's the cause of their illness.
okay. And maybe the red bullseye has long been gone.
Well,
Right.
40% of cases never get the bullseye,
Interesting.
and they don't even see the tick bite.
Okay.
They just get this debilitating flu-like illness, and they've been to every specialist, and they have not found out that the cause is Lyme disease. And that's mainly because the testing is very inadequate.
So as an investigator and also a physician, you take it upon yourself to like go for it, right?
So I had to go on a lot of conferences.
Okay.
I went to the International Lyme Disease Conference, which has specialists in Lyme disease from all over, France, Germany, America, look at all the research. I had to find laboratories that are going to do the proper testing. Lyme disease, when you go to the standard lab, they're going to test for one type of Lyme.
Okay.
There's now 15 different subspecies. So if you don't test for all the species, you're not going to find it. So I have some of that sophisticated testing in my office, as well as other things. We'll look at the microbiome of your gut. The bugs that live in your gut are going to help your immune system. If they're depleted, then your immune system's depleted. Then the Lyme disease gets worse.
So they say you need some good bacteria, right?
Right.
To fight the bad bacteria.
That's right.
So interesting. I've always found, like I said, science and medicine so fascinating.
Right.
Besides Lyme disease, what are some of the other, I guess, chronic illnesses that you're able to uncover and say, boom, this is
Right.
probably what you have?
So I have a lot of people come in with irritable bowel type symptoms, bloating, gas, constipation. They've been to the GI specialist. Again, that's going to lead me down the road of looking at the microbiome of your gut. I'm always amazed that the GI doctors don't do it,
Okay.
and I usually uncover the answer.
Got it. So
Right.
you'll be like, you have this parasite or you have this whatever.
Right.
Okay. Once you find the case, right? Once you unlock that mystery
Right.
and you bring that result to the patient, most of the time, are you able to treat the symptoms and maybe
So
help them, or
Most of the time they can achieve a wellness again. I
really?
can get them completely well.
Wow.
Most of the time, or at least 80%. So that's, again, going into a more holistic approach.
Which is what you do at
Right.
Zimmermann Medical, right?
Because I noticed that, pharmaceuticals can only maybe achieve maybe 30% of the time you'll get well, and then you'll relapse, especially with Lyme disease. It's really not a good answer.
Okay.
So I started getting into herbal medicine. I went on a lot of herbal conferences, and with herbal tinctures, it actually eradicates the Lyme disease much better, helps the immune system to heal. We do a lot of IV nutrition in the office because they're so depleted. So
And
we
is
have
that
to,
part of the regenerative medicine?
well, regenerative medicine's a term where I also delved into, people will come to see me and say, I'm 70 years old.
Right.
I'm a little tired. What can you do to regenerate me? So that's a whole nother talk.
That's cute. How
Right?
can I feel 30 again, right?
Right.
I know. I'll be 60 this year, and I don't mind telling my age, but I feel like I'm 42. So as
That's
long as
great.
I still feel healthy,
Right.
you know, it's the vibe I'm giving off, I'm going for it.
That's good.
But there are times where I'll notice, like, I'll be driving the car too long, right? And my hip joints feels like I'm pregnant again. Like my hip, I feel the
Right.
pain from being in a certain angle a different way. You know, maybe some exercise would help or whatever.
Right.
But your body, you know, it does,
Give you signals.
it gives you signals. It talks to you if you
Right.
listen, right?
That's correct.
What's one case, without naming their name, that you were able to help or cure? And what was that feeling like for you when you had a
So
success?
One of my first cases, a mother brought in her 19-year-old daughter.
Okay.
So she had gone off to college. 1 month after college, she started having searing migraine headaches. She didn't feel well, flu-like, had to come home. After she was home for a while, she started hallucinating. She would go out in the middle of the night looking for her grandmother, who was long since gone, and they couldn't really get her to give up on that. She wound up at the psychiatrist after many specialists. They came in to see me, and they said, what can you do for her? Well, if we looked at it, no one took a history. Everyone thought that she just had a psychiatric illness that just manifested out of nowhere.
Right.
No family history. On the history, the summer before she went to college, she was in a summer camp. She wanted to be a veterinarian, and she was helping the veterinarian with all the sick animals.
Okay.
So I thought to myself, well, what could she have picked up from one of these animals, and tested a whole myriad of infections, and it came out to be brucellosis. Brucellosis is mad cow disease.
My goodness.
Right? But no one took the history, and they just pigeoned her into mental illness. So we gave her the treatment for that. After a couple of months, she was back to normal, went back to college.
So it pays for someone to seek your expertise out.
And I think of
So-
things outside the box.
Yeah. So it
Right?
makes you unique.
Yes.
You know, and I thank you for letting us have you on to celebrate you, because I believe that people want to have a long, sustainable life. We even talked about the fact that you also help patients that do have a chronic illness
Right.
just have a good quality of life.
Yes.
Thank you, Dr. Lisa Zimmermann, for
welcome.
being here.
You're welcome.
You know, you're a champion for others, and I love that about you. So thank you so much. And if I ever start having more than just my hips hurt, I'm contacting
Right,
you
if
too.
it's unusual, or it's long-lasting, or no one figured it out,
Right. Come
I'm
and see
usually
you.
one.
There you go. Thank you so much.
You're welcome.
We've been talking about modern wellness, and we wish you all the best on your journey as well. Stay safe and stay healthy.